Hey, what's up and welcome to bonus 4 of Power Up Endo's 90-Day Super GP. This bonus lesson is dedicated to teaching you how I think you should go about scheduling your endodontic cases in your general practice. This is a short lesson, but it's really important because you need to know how much chair time to allocate for a given endodontic procedure, and I'm going to give you my recommendations. Let's get into it. So first and foremost, obviously, you know time is money, especially your chair time. So we have to balance being as time efficient as possible and providing the highest quality dentistry that we can possibly provide in our practices. It's a fine balance, and I wanted to include this image to really stress that point home that if you really want to be as productive as possible, which I know you do, you have to be very, very mindful of every minute of chair time that you are either utilizing or wasting. So you have to be super, super aware of that. And there are some things that you want to take into consideration when you're allocating chair time for endo procedures in your general practice. So first are the human considerations. A big part of the human considerations is your dental team's comfort level, and that includes you. So you need to know how comfortable you feel in performing endodontic procedures in your practice, and you also need to know how comfortable your assistants are and your front desk staff, let's say. So if your assistants are good to go, they're quick learners, and if you have, let's say, multiple assistants, that might get you into a situation where you feel more comfortable allocating a shorter amount of time for your endodontic procedures. But if you are a relative novice, your assistants are just getting into endo and they don't know whether they're going to feel comfortable in the routine, and if your front desk doesn't really know how to intake a patient and screen them for treatment, let's say, then that's going to require a longer amount of time. There's also a lot of patient factors as well. So is, this patient a pain in the you-know-what, or is this a long-standing patient that you've been treating for decades, let's say, and maybe your kids go to school together and you have a great relationship with, so that's going to be a different situation as well because they have a high degree of trust in you and they'll just basically do whatever you recommend for them. And then there's situational considerations. So is this a new patient to the practice? Is this patient all of a sudden having dental pain and they just Googled local dentist, came across your practice and called, and therefore you have to do, new patient intake and medical history forms and HIPAA forms and all that stuff? Or are they an established patient, again, that already has a great relationship with you and your practice? That's going to be a different situation in terms of how long that patient's going to be sitting, either in your waiting room or in your practice. Then your endodontic diagnosis is also very important. So not just does tooth type, whether it's an anterior, premolar, or molar, dictate how much time you want to allocate for your endodontic procedure, but also the diagnosis in general. So are you dealing with a vital case or a necrotic case? If you're dealing with a case that you know you're going to do in 2 visits, maybe you don't need as much time in that first visit, and then you only need a short second visit. Also, if you're dealing with a patient who has a significant amount of pain, especially on the lower posterior teeth, then you may need more time to get that patient fully anesthetized. Maybe you want to let your blocks soak in for a little bit longer, and maybe you're going to require supplemental anesthesia. Obviously, getting a patient to a level of profound anesthesia is great, but if you're having to administer more and more supplemental anesthesia, that's going to slow you down. And so you want to, kind of gauge whether this patient is dying in pain or whether it's, relatively asymptomatic. I want you to be as maximally efficient and successful as possible. So like I mentioned, wouldn't it be great if all your patients were scheduled for crown and bridge throughout your day? That's unlikely to happen, right? But if you could have procedures all throughout your day that are high revenue procedures that give you the same revenue boosting effects that Crown and Bridge does, wouldn't that be fantastic? So that you can be as maximally productive as possible per unit time that you're in the office, and this way you can have as much freedom as you like because you are being efficient in your practice and you're not having to grind it out day in and day out doing low revenue dentistry. I want you to succeed and I want you to thrive. So if you are a novice, then I would recommend this protocol for scheduling. So for your anteriors, your 3310s, maybe you need an hour of time. It really shouldn't require a whole lot more than that, even with a minimal amount of experience, assuming you know what you're doing and you've taken this training program and you have an idea as to what the routine should be. And then your premolars, your 3320s, you may want to designate 90 minutes for those, because maybe there's a second canal or a second root, maybe there's a third root and you feel comfortable handling those. I wouldn't do that if I were you. But anyways, you may find that there's actually a second canal when you weren't thinking that there may be, and that's going to slow you down a little bit. And so 90 minutes is a reasonable amount of time for the novice. And then your molar teeth, 2 hours should be enough time. If you start to butt up against that and you're not quite finished, then you may want to temporize and bring that patient back. More than 2 hours is a long visit for a patient in private practice. When you're in dental school or residency, you can book your 3-hour appointments and the patients generally don't care because they're paying pennies on the dollar. But a patient who's paying good money, to sit in a chair for more than 2 hours, that is a long procedure for them. So I really wouldn't recommend going further than 2 hours in a single visit for your endo procedures. And then if you're a super GP, which is the whole idea here, and you feel comfortable and confident in your endodontic skills, then I'd recommend scheduling something like this. And this more closely resembles how I personally schedule my endo treatments. So your 3310s, your anteriors, you may want to book for an hour. Your 3320s, your premolars, also you may want to book for an hour. And then your molars, your 3330s, that might be anywhere between 60 and 90 minutes dictated by the case. I personally book an hour for all my treatments. And if I have to get an emergency in, which I do basically every single day, multiple emergencies, and I have an anterior or a premolar, I might see an emergency alongside of that. But at least it gives me some consistency in my schedule, and it makes the front desk staff know exactly how to schedule my patients, so it's not so confusing to them as to how much time to allocate. They really love that. Also, if you finish earlier than what you anticipated, maybe you want to consider going ahead and placing your core buildup. And if you still have enough time, maybe you want to go ahead and start your prep and temp procedure. So if you give yourself enough time and you still actually find that you're finishing early for whatever reason, because it's a really straightforward case, then utilize that time to be even more productive than just performing your endo treatment. Wouldn't that be fantastic if you finished your endo, your core buildup, your prep, temp, and impression appointment all in that visit? Holy smokes, that's going to be an ultra productive visit for you, and then your patient can just return for their crown cementation. That would be amazing, and that would be the best possible scenario for you, and I hope you get there as soon as possible. So that's it. That is how I recommend you go about scheduling your patients for endo in your general practice. Remember, time is money. What you measure gets improved, and I really encourage you to keep a close eye on your chair time so that you can be as maximally efficient as possible and thrive professionally, which is what I want for you. All right, I will see you in the next bonus lesson.